Hi, we're here live at the 2017 Safe Patient Handling Mobility and Falls Conference in Glendale, Arizona, and I wanted to talk a little bit about this project. This was a project titled An Innovative Approach to Mobility in the Intensive Care Unit. It's a pilot study. It was conducted at Covenant Medical Center in Texas, and I had the privilege of assisting this group in processing some of the data research. So let me share some of that with you. First of all, we know that critically ill patients today are sicker, heavier, more complex than ever before. And what we wanted to find out in terms of our aim was, is there an innovative approach to mobility in the intensive care unit? Our specific objectives were to look at barriers to immobility within the intensive care unit. We wanted to understand the value of worker-generated solutions to mobility, and then we wanted to explore the impact of what we call low-tech, low-cost, high-compliance, high-reliability strategies. So with that said, what we did was quantitatively we did a survey, a multi-item survey to 25 registered nurses who worked within critical care, and then we did qualitative interviews with many of those same individuals. And this is what we found. We found that 94% of the ICU nurses felt that providing patient care was physically challenging. We also found out that 90% of the critical care nurses felt that at least 50% of their patients were dependent on their care for mobility. There were some other things that we looked at. For example, 75% of the respondents indicated that there was a relationship between patient handling and fall-related injury, and 90% indicated that there was a relationship between safe patient handling and reduction of pressure injury. So this was really kind of cool that there was such a high level of understanding around that. What we found from the qualitative perspective, because this is really what helped us understand how this influenced nurses and nursing practice. And what we found from that particular group is that when they talked about mobility, and mobility was an expectation, and they were asked what the root of that was, there were several things. One, they felt like management and the expectation around mobility was a driver. They also felt that accessibility of equipment was a driver. And the other was ease of use or lack of a disruption in workflow. Many of them mentioned the convertible chair, the mobility chair, specifically because that's a product that they'd had in their institution for many, many years. The product evolved, but the workflow patterns did not change, and many felt like that was the reason why they had so much success. Some of them even suggested that there was a perceived reduction in what we call the immobility-related consequences of care, meaning fall-related injury and pressure injury specifically. So really, really interesting study. The significance of this study is that nurses really do feel like, critical care nurses feel like their work area is hazardous, and we see that across the country and in studies from the ANA and others. They also felt like there was a relationship between patient handling techniques and the quality indicators. And we found that nurses will use safe patient handling technology if it's available and they know how to use it. And I think that's the heart of this study, was that the nurses really had the product and they knew how to use it, and that's what really lended to this whole notion of high reliability and high compliance. Thank you very much.